Hi, I'm Danielle Matias, one of the Prolotherapists at Caring Medical Florida. A common condition that we see in the office is hip labral tears. And for those of you that might be unfamiliar, your labrum is a thick ring of fibrocartilage tissue that helps to anchor the ball and socket joint of your hip. So if we look at this graphic here behind us, this is the hip joint. All of these white tissues here are ligaments that connect bone to bone, and your labrum is buried deep inside there. People that have labral tears often can actually have a tremendous amount of hip pain that limits them from doing most athletic activities or even walking. And they might complain of clicking or popping in their hip. They might have pain that they feel deep inside their hip, the front of the hip, or even at the side. And sometimes it even just gets worse with sitting. A lot of times surgery for labral tears involves anchoring the labrum and anchoring that tear back together, which might seem great in theory, but oftentimes this actually can make the labrum more likely to re-tear because it loses its pliability. If we look at this picture here, this is actually a picture from a surgery, and you can see here like that kind of suture anchor material on the soft tissue. We often hear from patients that have undergone this surgery and are still left with pain, whether or not they re-tear their labrum, or even if their labrum was addressed during surgery, they're still left with a lot of ligament laxity or ligament weakness and all that soft tissue that we saw that surrounds the hip. In other cases of patients that have undergone labral surgery years ago, they may have gone on to develop significant arthritis in the hip. If we look here, this is another picture taken in surgery where this person actually got a graft, a cadaver graft for their labrum, but you can see here, this is their cartilage, which should be this kind of shiny white, has already started to fray and wear down to the bone. In cases where surrounding ligaments, surrounding tissue are not addressed in labral tears, this is often what can happen, especially in active people. A better alternative for these types of surgeries is actually treating the joint comprehensively with a combination of prolotherapy and PRP or possibly stem cells to work to treat and heal labral tears, as well as strengthen and tighten any ligament laxity that can be present to work to rebuild this joint as a whole. Again, looking here, you have all of these ligaments that work to surround and actually support the labrum. So if you've done something where you get a labral tear, where you've really, through all these layers of tissue, torn the innermost tissue, chances are you've done something to all these other ligaments in that injury or with that wear and tear. Working to comprehensively treat that injury and again, rebuild that joint as a whole actually sets you up for better long-term success, especially if you're an active person that likes to run or mountain bike or cycle or any of those things. You need a strong joint overall. Not addressing these ligaments, not addressing all the other surrounding soft tissue can actually, maybe it feels better temporarily in the short term, but not long term.